Hello there, this is once again Jacob John from Tiju's Academy. Guys, I want to discuss something with you today. Many of the candidates or students, they do tell me what they exactly have to do when they get a role play card. It seems like they're all perplexed, they are so worried, they're so anxious, like where to start? What do I have to look at it first? And where should I search for what to speak for? Today's video is all about that. As I have told you in the introduction, whenever you get a role play card, we all know it's divided into three segments that we have to look for. And what are they? The first is setting. What is the importance of a setting? Why do we have to look for the setting? You must be knowing the answer. But still, setting is very important. Why? Because it actually makes you understand where you are standing. We get a different settings, isn't it? A lot of settings are there. Can be a GP's clinic, can be an accident and emergency room, can be a hospital ward, can be an outpatient department, and it goes on. After the setting, what do we look for? We do pay attention to scenario. Scenario is very, very important. We can read the scenario. If you want, you can underline the scenario. If you want, you can encircle. You can try to find out whether it's a known case or an unknown case. Once you understand it's a known case or an unknown case, you're sure about it, isn't it? What all you can get from the scenario? There are so many data, there are so many information that you can collect from this scenario. First of all, who you are. Are you the nurse? Are you a registered nurse? Are you the nurse in charge? Or are you the head nurse? Look for it. And after that, to whom are you speaking to? You understood the setting. Now in the scenario, to whom are you speaking to? Are you seeing the patient for the first time? Or is he a patient in your ward? There are a lot of data, as I have told you, you'll be acquiring from the scenario. After getting thorough with the scenario, we are going down towards the task. There would be sometimes 6 tasks, sometimes 8 tasks, sometimes 10 tasks. It's not a lot to take. You can rearrange the task the way you want. You can start the speaking the way you desire. But there are 2 things that you have to keep in mind. And what are they? The first is you have to listen to the interlocutor. Why? Interlocutor is the person who's interlocuting a conversation on behalf of an original patient, relative, bystander, carer, caregiver, or a sibling. So it's really important for you to answer to the question. Do not get stuck in between like, oh, I did not prepare it this way. How come the interlocutor is asking me out of the blue? It shouldn't be your question mark. It should be random. You should respond to what the interlocutor is asking you. And the next thing that you have to keep in mind is task fulfillment. If you're going to abide with all the rules and regulations that I have told you, you are sure to get an achieved score or a desired score in your OET 2-pointer speaking sub-test. And moreover, role play, it's not only going to be a fun examination, but it's going to be an easy way to maintain an interpersonal relationship with your examiner and achieve a good band score.